Tonight, it is both grief and relief in some quarters as 64-year-old nurse Rosemary Namubiru is handed a 3-year jail term for negligence with intention to infect someone with an infectious disease. Now, reactions have been fast and furious after the verdict in a case heavy with emotive undertones. Now, on NTV Take 5 tonight, the General Secretary of the Uganda Nurses and Midwives Union, Edith Nasuna, joins us to throw more light on the verdict. You can join the conversation on Facebook, Twitter and SMS. Our hashtag is NTV Take 5. You can get us on our Facebook page on NTV Uganda fan page. Our SMS number is 6565. Remember to begin with Take 5 or send us an email on take5@ntvuganda.co.ug. Welcome to NTV.
Thank you very much.
It's good to have you with us. Now, about the ruling, what is your reaction? How do you feel about the ruling?
Well, I was happy about the ruling. Being a professional nurse and somebody who respects the Constitution of Uganda, of the 1995 Constitution, there is protection of human rights. In Section 22, it reads, for the purpose of preventing the spread of an infection of any contagious disease. That's the mandate for all health workers, not only nurses, but all trained health workers. We are there to protect the lives of our clients.
So you feel that justice was served?
Justice was served to this innocent child.
To the innocent child.
Yes.
So how do you think that this ruling is going to impact the way nurses and midwives, or like you have put it, health workers operate?
Not only nurses, but all health workers. This is a lesson for them to learn. Because as nurses, we have got our professional councils, which are responsible for registering us to practice our nursing profession and to renew our working certificates every 3 years. Not only that, as professionals, not only nurses, even doctors, even allied health professionals, we will come to be responsible that we are the people to take care of the clients and not to carry on infection.
All right. There are some people who are saying that maybe Rosemary Namubiru should have faced disciplinary action as opposed to the courts. What's your take on that?
For me, what I saw, what I followed, because I knew the parents of this child were the sole responsible people of this child, and they knew their rights. You know, in Uganda, if really judiciary would be very responsible to promote the client charter and the patient's charter, whereby you, an innocent person, you'll have to know what is going to be done on you, what procedures, are they safe? Now we are having this rampant disease, HIV. It wouldn't be nice for a health worker to see that Namubiru really knew very much that she's already infected with HIV. She knew about the problem. And she knew about the spread. What she would have done is to see that if the cannula had pricked her, and she knows the mode of infection, she wouldn't have gone ahead to pass that cannula to this innocent child, because she's a nurse who is supposed to control infection.
Which was negligent on her part. But
that was really negligent on her part.
Shouldn't she have faced disciplinary action?
Yes, she would have faced disciplinary action, because I think Namubiru was working under her supervisor when she's carrying out all the procedures. But I think she even tried so much to see that the supervisor was not knowledgeable about what happened. And this was a private institution, whereby there was a negotiation between the parents of this child to take this baby or this child to this private institution when they have already paid. And then somebody who was taking care of this baby, the mother or the father, whoever the client, saw this incident happening and they became worried.
The HIV activists are saying that probably this ruling could star or, you know, be evidence of the stigma towards HIV patients. What is the union's take on this? Do you agree with the HIV activists?
I can't agree with the HIV activists, because if they are HIV positive activists, there are laws, there are conventions, there are ILO conventions which are in the world, which protects the workers with HIV. But for somebody to be with HIV and you intend or intentionally, there was no hurry for Namubiru. She would have discarded of that cannula and picked another cannula and passed it in this child. So the HIV activists, sorry, for me I'm saying Namubiru really neglected her duties and intended to infect the child. But if she had to go through the normal procedures of disciplinary action, you know, the nurses, the union is responsible for the economical rights of the worker. And if you have not protected the worker from an infection, we can put down our toes because you are exposing us to an infection, like let's say in case of Ebola. Or if I'm carrying out a procedure, taking care of my HIV patients in a hospital, and you don't give me protective gears, of course I can say, Mr. Employer, can I wait until when you give me gloves to protect myself? Rights to. Yes, as a worker. But it is still for you, the worker, to protect the lives of the clients.
All right. The verdict comes as an HIV bill which criminalizes the transmission of HIV is, you know, is about to be signed into law. What's the union's take on this?
It will be vice versa for both the employer and the employee. If the employer does not provide protective gears to his employees, does not carry out continuous medical education to his employees to know about the prevention of HIV, does not provide a conducive working, a decent work to the employees, and just give them, okay, let's say, few utensils, few gadipos, no, they share everything. So the workers, once they are exposed to infection, then the employer will be penalized. But for the standards and the ethics and the code of conduct for the health workers, then the bill will also affect them. And then what is really I want Ugandans to know, we have to make sure that there is a client charter and a patient's charter, so that the community can know, because it is the health worker who is solely responsible to take care of the lives of this community in Uganda.
Thank you so much. I wish we had more time to talk more about the bill and your thoughts on the verdict. I've been talking to Edith Nasuna, the General Secretary of the Uganda Nurses and Midwives Union, you know, throwing more light on the verdict that was issued to Rosemary Namubiru, who was handed a 3-year jail term for negligence with intention to infect someone with an infectious disease. That was NTV Take 5.